بسم الله الرحمن الرحيم. بحث التخرج بعنوان Assessment of Vitamin D and its Correlation to Dental Caries. إعداد الطالبتين زهراء منير وبسمة أحمد بإشراف الدكتورة شيلان. This study aimed to investigate the relationship between caries experience and level of vitamin D in serum. This study was conducted from January to April 2020. Blood sample taken from 20 patients, 10 male and 10 female, who suffered from dental caries. Their age ranged between 25 to 40 years. Blood sample collected and subjected to analysis in Al-Ghazaliya lab in Tikrit. Assessment of caries prevalence was carried out by clinical examination using DMFT and DMFS indices. The result showed that the vitamin D level in caries experience group was 21 plus minus 9.29. This level is very lower than, when compared with the normal value 35 plus minus 5. We also showed that the significant difference in level of vitamin D between male and female 2.26 plus minus 10.3 and 16.2 plus minus 5.56 respectively. Aim of study. The aim of this study is to evaluate the relationship between level of vitamin D and dental caries. Dental caries is one of the most prevalent diseases. The widely recognized inverse relationship between the prevalence of dental caries and the ingestion of fluoridated drinking water prompt investigator to look at other trace elements. Investigation suggested that some trace elements cariogenic, mildly cariostatic. Dental caries refer to destruction susceptible of dental hard tissue by acidic product of the bacterial fermentation of dietary carbohydrate. Dental caries is a chronic disease that progresses slowly in most of people, which result from an ecological imbalance in equilibrium between tooth mineral and oral biofilm plaque. The biofilm is characterized by microbial activity, resulting in fluctuation of plaque pH. This is a result of both bacterial acidic production and buffering action from saliva and surrounding tooth structure. Primary caries can occur on different tooth surface. On proximal surface, the lesion start and form beneath the contact area between teeth. Caries on an occlusal surface is also a localized phenomenon in pit and fissure. Secondary caries is a lesion located at the margin of restoration. It represents a caries lesion adjacent to the margin, and there may be signs of demineralization along the cavity wall, which could be a consequence of micro. Vitamin D is a fat-soluble vitamin that is naturally present in very few foods added together and available as a dietary supplement. It is also produced endogenously when UV ray from sunlight strike the skin and trigger vitamin D synthesis. Vitamin D obtained from sun exposure, food, and supplements is biologically inert and must undergo 2 hydroxylations in the body for activation. The first occurs in the liver and converts vitamin D to 25-hydroxyvitamin D, and the second occurs primarily in the kidney and form the physiologically active 1,25-dihydroxyvitamin D. Vitamin D promotes calcium absorption in the gut and maintain adequate serum calcium and phosphate concentration to enable normal mineralization of bone and to prevent hypocalcemia tetani. The function of vitamin D in tooth development is that impaired tooth composition is more prevalent in subjects with vitamin D deficiency, but the association may be overlooked since clinical manifestations appear after significant delay. Based on the effect of vitamin D on tooth quality and the innate immune system. Vitamin D helping to build strong bones and healthy teeth. Material and method. This study were carried out on 20 patients, 10 male and 10 female. Their age ranged between 25 to 40 years who suffered from dental caries. Blood samples were taken from patients for obtaining serum, and we centrifuge all samples. Firstly, we should take 50 micron of serum and mix it with 50 micron of releasing buffer and put the mix in the incubation for 5 minutes at 30 Celsius. Then we will add 100 micron of detecting buffer to the mix and mix them together and put them in the incubation again for 15 minutes. After that, we should take 75 micron from the mix and put them in the cassette. After that, we will put the cassette in the incubation for 8 minutes. Finally, we will read the result by iChroma device.
Assalamu alaikum. My partner Zahraa Munir, she was talking about introduction, also material and method, and I will complete the result that we get. Table 1 shows that the level of vitamin D in a patient with dental caries was very lower compared to the normal value in a healthy one. The statistical analysis clarified there was a significant difference between them, which is about less than 0.01. Table 1 is describing the level of vitamin D in a patient with dental caries at normal value. As we see here below in this table, we have two groups: dental caries, which is above 21 to less than or more than 9, normal value group about 35 to more than or less than 3. Significant difference between them, which is about less than 0.01. Table 2 describing the level of vitamin D in a male and female of dental caries group. Male about 26 to 10, female 16 about 16 to 5, and significant difference between them, which is about less than 0.05. Dental caries is a microbial disease of calcified tissue of the teeth characterized by demineralization of inorganic portion and destruction of the organic substance of the tooth. Vitamin D deficiency is a public health concern, and lack of vitamin D supplement was associated with vitamin D deficiency. Proper fortification policy, health education, and regular screening may help in preventing and treatment of vitamin D deficiency. In this study, we analyzed the relationship between a blood 25-OH constriction and dental caries in the permanent dentition of a patient in this study. Results in present study show that there was a significant difference in a vitamin D level between dental caries and normal value, as we see in table 1. And this result is maybe due to that the vitamin D play a vital role in a tooth development and protect it from risk of getting dental caries. Decreasing in vitamin D status has shown a significant increasing of periodontal disease. People having correct amount of vitamin D status in their bodies are less likely to suffer from dental problem, bone-related problem, also from cancer. Thus, vitamin D play a major role in human body. Its deficiency can cause some severe outcome and problem in the body. Correct amount of vitamin D is being advised to avoid dental and other problems. In our study, we observed that the level of vitamin D in males was higher than the female, as we see in table 2. Many studies show that the vitamin D deficiency was highly prevalent, particularly among young adults and those with central obesity. A high prevalence of vitamin D deficiency is reported across the country among people in all age groups, both gender, lower to high socioeconomic status. Also, this study showed that the vitamin D deficiency was highly prevalent in both male and female. But female, the deficiency of vitamin D was higher than male. This result is maybe that in Iraq, male are exposed to sun more than female, or the male patient was supplemented with vitamin D. Finally, you have our conclusion. First, there was a significant difference in the level of vitamin D in serum of patients with dental caries at normal value. Second thing, there was a significant difference in the level of vitamin D in serum of male and female with dental caries. Thank you.